If you can hear me, text chat. We're not going to open up the phone for questions today during this webinar. We're going to just use text chat so that we can answer all questions at the end of the presentation. So again, this is Sandy Abrams. We're here for our first webinar for OPI training. And one of the requests we've had is regarding all of the consumers that we've had to reduce OPI services for, or we've had to close OPI people. And we wanted to look at what resources could be uniformly available across the state, and one of those is the Homecare Choice Program. It has just recently launched, and Jenny Coakley is here with us today and is going to be sharing with us further information about it. Jenny?
Hi, everybody. I'm pretty excited to be here today talking about the Homecare Choice Program. You have a PowerPoint presentation, and then I asked Sandy to send out a couple of other things. One is frequently asked questions about the program, and you can hand that out to whomever you would like. And then also, I had her send a quick reference guide that we can use for consumers and families that really just walk them through the enrollment process, kind of the bare bones. This is what you need to do to enroll and pay for services, and this is how your caregiver gets paid. So use those as a resource. I'd be happy to order print copies for any of the offices that would like them. I can have them printed and shipped to your office. That way you have plenty on hand if you want to tell somebody about the program.
And again, if you would like those printed copies, text chat that information for us, and we can make a list of that so that Jenny has it.
So just a little brief background about the Homecare Choice Program, and then I'll get into what you really want to know. This program came about during the 2014 legislative session. Senate Bill 1542 passed, and the legislature said, Homecare Commission, you need to create a new in-home services program for private pay individuals. And we want you to do this by opening up your registry so private pay people can go in, hire somebody they want, make sure they're background checked, and then Commission, you help them by paying the provider and covering them under workers' compensation, withholding the taxes. So really taking those complicated parts of being a household employer and helping people meet those responsibilities. So that was kind of it in a nutshell. If you want to look up the Senate bill, you're more than welcome to. I should have it memorized by this point, I think. Senate Bill 1542. We have temporary organ administrative rules out there, and they'll be permanent at the end of June. So if you want even more boring stuff to read. So if Sandy goes to the next slide, it has our contact information for the program. So what you'll find with this program is it's really administered through the commission, so the local office doesn't have to do much of anything other than please give the information out, have them call us, have them email us, and I'll go over that in a minute. But we have a toll-free line, we have our own email address, and we have a website that launched, I think it was this week or last week. And that's where we'll be directing consumers to sign up for the program. So if you go to the next slide, I just put a little snapshot of the website. So that's what you'll see, and this is what consumers will see when they're interested in the program. So on the website, it has information about going into the registry. There's a big Let's Get Started button. So if they want to enroll, they just click that, and it begins the enrollment process. But there's also information on there about the different services that can be provided, information about the caregivers, kind of those ins and outs of the program. We also have a rate calculator on there. So if somebody is kind of on the fence about wanting to sign up and concerned about the cost, they can use the rate calculator and get an approximate cost of how much it's going to cost to participate in the program. We also have frequently asked questions on there. We also have downloadable forms. So from there, there's a quick reference guide. There's blank reference check forms, performance evaluation forms. Oh, sorry. Should I change? Yeah. Sorry, I got on a roll. So there's a lot of different downloadable forms other than the ones I just mentioned. And you're welcome to go in there and take a look and use any of those for any of your consumers as well. Also, we have resources, and we have, I'm calling it steps-like material, because steps is not available through Homecare Choice. It's a Medicaid service. So we have steps-like where we can provide information either in writing or over the phone about being a successful employer. So interview tips, how to successfully communicate with their caregiver, warning signs that maybe this isn't the best caregiver for them, how to create a job description, even figuring out what it is that they need. So you're always welcome to go in and look at that information and even print it out for whomever you would like. So I know that STEPS is available for OPI consumers, but if they're not going through OPI and they are interested in doing the Homecare Choice program, we do offer STEPS-like information. So our Homecare Choice specialist has gone through options training, and he has also shadowed STEPS counselors in the community. So he's prepared to be able to walk people through how to be an employer. I'll go to the next slide. So why refer people to the program? So it's a great way to help people who, one, don't qualify for Medicaid. So it could be they have too much money, or their service needs aren't high enough to qualify for Medicaid, but they do still need some help. And maybe there's an OPI wait list, or there have been budget cuts. So we're actually getting calls from individuals saying, I receive OPI services, but my budget was cut in half. So they actually enroll in our program and OPI, and then we work together to kind of manage that case. So we enrolled somebody, we began enrollment in January. So we enrolled a couple who live in Lake Oswego, and he had 20 hours a month through OPI, and then unfortunately with the budget cut, that went down to 10. So he uses 10 through OPI, and then they pay privately for 10 through our program, and they're able to use the same provider. So there's that consistency there. So you may have OPI wait lists. This is just another option to provide to them if they really need services in their home and they don't want to go through an in-home agency. So really the Homecare Choice program is all about choice. They get to choose who they want to come into their home and provide services to them, unlike an in-home agency where they assign the worker. So it's really for those people who kind of want to have complete control over the services in their home. Another reason to refer people to the program, they may already have an employee working for them, somebody they've been paying privately, but they don't cover them under workers' compensation, and they may the tax stuff may be too confusing for them, and they want something more simple. So we can enroll the person working for them through our program and get them set up as a Homecare Choice provider, and we can enroll the consumer, and then we can really help them go through that household employer, all those responsibilities. We're able to cover workers under workers' compensation. That's one of the things that people worry about when we were getting calls from the community. How do I cover my worker in case something happens and they get hurt? And then it's just another option for people. One of the intents of Senate Bill 1542 was to provide another option for people in the community, a safe option. Instead of going to Craigslist or another website or putting up something on a bulletin board, because we know the providers working with us have background checks and they have access to training. So it's just a safer option. So the only thing we're asking you to do is to refer people to us. You can provide whatever information you would like. If you want to give them the quick reference guide, the frequently asked questions, when our brochures are printed and I send them to you, you can give those out. But in terms of enrolling providers and consumers, you would just send them our way. When we developed this program, it was really to have very little impact to the local offices at all. So it's all ran out of the Oregon Home Care Commission. You go to the next slide. I wanted to talk just briefly about the differences between Homecare Choice and Medicaid or OPI. because there are some pretty big differences. So in the Home Care Choice program, it's completely employer directed. So we don't assess that person. They do a self-assessment. So we don't have a case manager going in, doing a CAPS assessment, developing a service plan, and saying, consumer, you're eligible for 20 hours a month. All of that comes from the Home Care Choice participant. So they go into the registry, they do a self-assessment, they say, oh, I want help with housekeeping and bathing and shopping, and I want somebody on Wednesday afternoons, kind of what they do on the registry right now. And then they decide how many hours they want. That's not determined by the commission. So they could say, I want 100 hours a week. Great, you can have whatever you want. So the eligibility is not based on how much help somebody needs, unlike Medicaid and OPI. For somebody to be eligible, they need to be able and willing to direct their own services and pay in advance for those services. So I think what we'll see in this program are people who don't qualify for Medicaid because they don't require as much help. And I think we'll see a lot of people who need housekeeping and companionship and things like that. So another big difference are the services that are available in the Home Care Choice program. So we can offer services that other programs can't. So we can provide pet care and companionship. Those are things like helping with hobbies and crafts or going on social outings. Could be going on a walk with somebody, or it could just be being there with that person to make sure they're safe. What we've said all the time, in like Medicaid especially, if the home care worker is going to be there, they have to be doing something. Well, in this program, they can just be with that person to make sure they're safe, to be a companion. And we also pay, another service is running errands. So it doesn't have to be related to medications or grocery shopping. It could be, I need somebody to run me to the bank or whatever it is. So there's a lot more flexibility. Another huge difference is we use what's called a fiscal intermediary. And that's a company that helps individuals with the legal requirements of being an employer. And we are using Public Partnerships Limited, and it's a web-based system, so it's all online. So they will issue and process electronic timesheets. So there are no vouchers in this program. They pay the providers, they withhold and report the taxes, they help the employer get an employer identification number, they also issue the W-2s to the workers at the end of the year. If you go to the next slide, you might get the question from participants, well, why should I enroll in this program? Why not use an in-home agency? The main selling point of this program is they get to choose. They choose who comes into their home. They have a direct say. They interview and they hire. Now, in-home agencies will be completely appropriate for a lot of people, and this program may not be the best fit for them. We don't do emergency backup services. So if the worker calls in sick, we don't have anybody we can send. This is really their responsibility. And we don't provide nursing services. So unlike, the community health RNs, we don't have that part of the program. So if they do have some unstable medical needs, they may want to consider an in-home agency. It's a safer option than hiring directly from Craigslist or other websites. All the workers have passed the background check. They have access to ongoing training. And to be available for referral for our program, they have to have continuing education just like they do for Medicaid or OPI. All the legal requirements of being a household employer are met when they use that fiscal intermediary. Their providers are covered under workers' compensation, and most of what they pay, that $22.12 an hour, goes to their worker. So the workers get paid $14 an hour. So a lot of people we've talked to really like that their workers get a living wage. One of the things to know is we're using the existing workforce of home care workers and personal support workers. A part of the Senate bill was to say, you need to increase the workforce, you need to bring people to this type of work, you need to make sure there are enough workers available for those receiving state assistance and those paying privately. So the best way to do that was to have everybody go through the same door of, either being a home care worker or personal support worker, and then they have the opportunity to come into home care choice. So if a provider asks, well, why should I enroll in this program? one of the selling points to them is that they can pick up extra hours of work that don't count towards overtime. So these hours are not being combined with Medicaid or OPI or across programs. So they can work, if they're cut off at 40 hours a week for one program, they can pick up extra hours through us, and they're not eligible for overtime through our program. The consumers are, but those hours don't combine. They're covered under workers' compensation. They're guaranteed $14 an hour. So they don't always receive that when they are working privately for somebody and they've done their own negotiations. Taxes are withheld and reported. They use an online time capture system that they can access 24 hours a day, 7 days a week, and they can see the status of their time card and payment whenever they want. They don't need to call the local office and say, I didn't get my voucher, hey, where's my paycheck? They can go on to this system and see that. They would go in and enter, they would create a timesheet and say, I worked on this date and I did these services and I got to work at 8 a.m. and I left work at 5:02 p.m. and they fill out an electronic timesheet, and then the participant goes in and says, yep, I agree, they worked those hours, and they push a button and say, approved. So if there's any problem with the time card, the system knows right away and it won't let it go forward. So then the consumer can say, oh, you know what, she didn't work on the first, she worked on the second. So they can either accept or reject the time card. So it's nice that you don't have to go through the local office for that. And then the other selling point is they can provide services that Medicaid and OPI can't. So I get the feeling, maybe they don't want to do a lot of heavy care and they really want to just do some of those instrumental activities of daily living that just really they're limited in Medicaid because the bar is so high that somebody needs so much help. So if you go to slide 8, this is just a quick overview of how does a participant enroll in the program. So in order to enroll, the first step is completing an employer pre-screening on the registry. So that's the step when they click, let's get started, they go through these series of questions and it helps determine whether they have the skills or the willingness and the ability to direct their services or do they have a representative to help them with that. So that's actually in the Senate bill that a person has to be able and willing to direct their services. So we ask questions like, can you interview and hire somebody? Can you tell your caregiver what you want them to do? Can you tell them what you like and don't like? Would you be willing to let them go if they're not working out for you? So we try to use some simple language on that pre-screening tool so people really understand what it is that we're expecting them to do as an employer. So once they pass through that, if they answer no to any of those questions and they don't have a representative, they can't enroll in the program. It stops them. Then they go on and complete a self-assessment on the registry. I should mention to you that it's not a brand new registry. When I say registry, it's not a completely separate registry. It's a different door to get into the registry. So for those who don't want to be in the program and they want to hire somebody privately, they would just go on to the existing registry that they do now, hire somebody and go off and do their own negotiations. So for our program, they would go onto the website that I have at the beginning of the presentation, and it's just a different door. So the workers will go in the same way they always do. So if it's a home care worker or a personal support worker, or a home care choice provider, they all go into the registry the same way. They're just going to see some different screens, and I'll tell you about that in a second. So they go in and complete a self-assessment, and we wanted it to be simple to use and kind of like a TurboTax. If they didn't need help with a particular thing, we didn't want to have them go through that and say yes or no. For instance, if they need help with housekeeping, they can click housekeeping, and then a list will expand and it'll say, I want somebody to help me with dusting and doing dishes and those more specific tasks. But if they don't want somebody to do housekeeping, they don't have to go through all of those questions. The same with medication management. There's a lot of different things that you can do with medication. So if they need help with that, they say yes, then that list expands. But like bathing, for instance, is just you click it or you don't click it. It's not as specific as the service priority level rules and all those definitions because the program's not based on how much help you need. So based on their self-assessment, it will develop a service plan. It'll auto-generate with all the information they put in there that they wanted. And then in order for a worker to work for that participant, they have to sign the service plan and give us a copy of that. And again, that was in the Senate bill, so we have to do that. So the next step is finding and hiring a provider from the registry. So when they are accessing the registry for the first time, our staff reviews all that information with them. We review the pre-screening questionnaire and the self-assessment, and then we generate a list for them. And then after that, they can go in anytime and run their own list. So once they found somebody they want to hire, they need to pay the commission in advance for services. So they would pay $22.12 per hour. And that rate it covers the workers' compensation premium, the use of the fiscal intermediary, it's the staff wages, the workers' wages, the unemployment insurance, it's home care choice staff, it's all the little charges to run a program. So the $22.12 doesn't go to the worker. And then once they do that, they complete all the paperwork for the fiscal intermediary. So as soon as they fill that out, send it to the fiscal intermediary, and they get an employer identification number, they're good to go. So if you go to the next slide, how does a provider enroll? So they have to already be a home care worker or a personal support worker. If they're not, they can enroll. We will either direct them to a local office to enroll as a provider, or they can go to one of the commission's recruitment events. And if they live locally in Salem, where the commission is, we've actually done enrollment one-on-one for the home care worker and personal support workers. So I should mention, a lot of the referrals we're getting right now are from existing workers who they are working for somebody privately that, the person's found them on the registry, and they say to the consumer, hey, why don't you check out this program? And that's where we get a lot of the referrals. So they have to already be a worker. They have to have an active provider number. So you probably already know if a worker isn't paid within 12 months, if they haven't worked and are paid within 12 months as a Medicaid provider, their number goes inactive. And if that happens, they go inactive in home care choice too. So as a way of expanding that workforce and making sure people are available to serve Medicaid and OPI consumers, we said you have to have an active provider, which means they have to work at least 1 hour every 12 months to even be eligible for the program. The next thing we have them do is take and pass an online orientation and readiness assessment. And that's kind of a hybrid of this is what the program is, this is what you can do, this is how you get paid, and then combining it with training elements. So this is what medication safety is, effective communication, how to be professional, safety issues, abuse prevention. So it's kind of a mixture, and then there are questions intertwined that they have to pass. So if they get a score of 70 or better, then they've actually passed the readiness assessment. I'm sorry to say that some people actually don't get to 70%. So when we worked, before the program was launched, we were really doing a lot of development. We met with a lot of stakeholders to say, what qualifications do we want of the providers in this program? And that was one of the things. Because there's not a lot of oversight, the consumer is the employer, there's not a case manager. We want to make sure they have those basic problem-solving skills, those communication skills. So after they do that, they sign an enrollment form that's specific to our program. So it won't be an enrollment form they sign for Medicaid. Then they go in and update their information on the registry. We've added new screens to the registry. So the first time a worker goes in, it'll say, do you want your information released to Home Care Choice? And it'll be yes or no. So you may have received calls recently from people saying, what does this mean? Because it was new for all the providers on the registry, so they happened to see that. So there is a IM out there, and I'll tell you the name in just a second, but it tells you about those screens. You don't have to do anything with them. It's really just information for you. This is what looks different on the registry. Anything that needs to be filled out on the registry is done by the worker or Home Care Choice staff. So after they update their information in the registry, they complete all the paperwork for the fiscal intermediary. So for every consumer they work for in this program, they have to do a new I-9 and the tax forms because each person they work for is a separate employer. And then they sign a service plan and they can start working for that participant. Go to page 10, slide 10. That's just a visual way to say you don't have to do this stuff. That's another way to look at it. Other than, please send people our way. We'd really appreciate the referrals. But the commission and the fiscal intermediary take care of all the provider enrollment, participant enrollment. The consumer does the assessment and service planning. The providers are paid by the fiscal intermediary. We handle all the provider terminations. So we work with central office. So if there was a naughty home care worker on the Medicaid OPI side, we could terminate them from our program as well. So again, they have to be an active home care worker. If they were terminated as a home care worker, they're going to be terminated in our program too. And then the next slide just has staff contact information. So the IM I was referencing, and I'm going to send it to Sandy and ask her to forward it out to everybody, is APD-IM-16-035. And it just walks you through some of the new screens. It'll make a lot more sense when you can see it, but some of the things that might concern workers when they go in is they'll see their availability, and it'll say home care choice status, and it might say unavailable, orientation needed. That's not orientation through you guys. That's orientation through home care choice. So it doesn't affect their ability to work as a home care worker or personal support worker at all. Or they may see unavailable enrollment agreement needed. That's for home care choice, not for Medicaid or OPI. So again, it has no impact on their ability to work for OPI consumers or Medicaid. And that's pretty much it in a nutshell.
Yeah, thank you, Jenny. We've gotten some questions while you've been sharing. And one of them is, does the home care worker get leave time or health insurance through this situation?
That would be fabulous if they did, but unfortunately right now they do not. We can't use the union's trust. We've tried. So until we find a way to be able to provide that benefit for workers, the hours don't pull together toward insurance.
Thank you. And by the way, folks, if these questions that I'm taking off from your question do not completely answer, would you go ahead and put into the chat or into the questions other questions or follow-up questions you may have? So Jenny, we received another question that says, can they do outside work, like yard work kind of thing?
No, they can't do yard work. And actually in the Oregon Administrative Rules, we list all the things that are not covered under the program. But if the consumer's hobby is gardening, they can help the person with the participant's hobby. But they can't go out and do weeding and mowing lawns and actually do the gardening. It's something they do with the consumer, like the gardening.
Do you recall, Jenny, what are the other tasks that aren't allowed other than outside yard work?
It would be, like, we don't have live-in services through this program. They can't do any kind of home modifications. They can't do muck-outs or taking away dangerous conditions in the home, like repairing the stairs or removing all the vines from the stairwell. We don't cover the purchase of any services. So if they need gloves for their worker, that's something that the consumer needs to do, and we let providers know you need to advocate for yourself. If you don't feel comfortable doing something without gloves, let your employer know. So as with home care workers, they can get gloves through the local office. That's not an option in this program. We don't provide any kind of durable medical equipment or anything like that. So I should say, if somebody requires more resources, we're going to refer them to the options counselor in their community and to the ADRC.
Thank you for that clarity. Could you tell us what can a consumer do who's maybe not computer literate or confident on the computer?
So first we're going to check to see, do they have somebody who can help them with that? Do they have a representative? If not, then we will help them with that. We'll call them or they'll call us and we'll walk them through the steps of the registry. Something nice about the fiscal intermediary, the electronic time capture system, is you can use that on a smartphone or a tablet, so you don't have to have a computer. Same with the registry. You don't have to have a computer.
Jenny, can you explain to us, because I'm not sure that it was clear, why does the consumer have to pay in advance for the service?
So the consumer has to pay in advance, one, because the Senate bill said they have to, and two, the state can't incur any cost of the services. So the consumer has to have the money up front so we can make sure that the worker can get paid and the fiscal intermediary gets their money. So for the first month they enroll, they actually give us 4 weeks worth of funds. And then after that, they can pay every 2 weeks. But we always have those 2 weeks left behind in case there's unexpected overtime or if they need somebody to work more hours during that month. Or they are paying somebody for mileage. They determine the mileage reimbursement rate. So we always have funds available so that we can pay workers. Does that answer that question?
Yeah, I think it does. And if not, I want the person who asked it to explain further. Can you explain, can folks assist with financial planning and maybe doing some assistance with bill paying, that sort of thing?
No, thank you for jogging my memory. That's also in the rule. That's something that's not available in our program, financial management services. We don't want providers assisting.
Okay.
Yeah. Or case management. So case management is not a service available through this program, nor is nursing services. So we do have a list of community health RNs who said they are interested in working for private pay individuals. We can give that list out. But medical services or nursing services isn't something that's available on Homecare Choice. So if somebody does have a lot of medical needs, they may want to consider an in-home agency.
So, Jenny, there's some questions about what is a physical intermediary. Can you explain that term for those of us who don't use that term very often?
A fiscal intermediary is a company where they specialize in doing all the tax-related stuff of being a household employer. So it's a company that helps people with the tax forms. They help them process those forms. They actually pay the providers. They withhold the taxes. It's kind of a financial management service in terms of paying the provider and getting somebody enrolled as a household employer. So with the Medicaid and OPI, the state kind of takes on some of those responsibilities by paying the workers and withholding the taxes and issuing the W-2s at the end of the year. Since we're not using the state for that or any of the state systems, that's what the fiscal intermediary does.
I'm just reading through the questions and trying to get the whole thing. Is there anything that's come to your mind, Jenny, that you thought you wanted to share with us a little further while I'm checking over these questions? Okay.
Oh, yes. Here, I thought of something.
Awesome.
We have the quick reference guide, but we will also have consumer guides and provider guides. So the consumer guides are at publications, and they're making them all spiffy, and then we can have those available. And that provides a lot more information than the website and the quick reference guide, and it gives them tools about writing job descriptions and doing evaluations, and this is what the program is, and just more in-depth information.
How is the state getting their fees when a client, or a participant in this program, calls the home care worker directly?
They have to go through our program. If they contact the worker directly, then they're not in our program. So we could have a conversation with that person to say, you know, if you want to make those arrangements yourself with the home care worker, you can do that. Otherwise, to be part of this program, you need to pay the commission, because it's not just the worker wages, it's administrative fees for running the program. So one of the reasons we give them the list initially is so we can walk them through that. This is a statewide program. What has been nice about this is a lot of our initial calls have been on the I-5 corridor. So we've actually been able to go out to people and sit down with them and go over everything, which has been pretty nice. But because it's statewide and the commission is in Salem, we won't have the luxury of doing that all the time.
So if the person who takes the job and the consumer hires them, what if they don't last very long? Maybe they go to work for a week and decide this is harder work than I want, or I don't particularly care for that consumer, and they quit. What does the consumer do?
The consumer can hire another worker off the registry. And if they can't find somebody or they decide they don't want to do that, they can disenroll from the program and they'll get a refund. But one of the things I forgot to mention is we don't just have one contact with people. So after the process, we follow up with them. Have they identified any needs that really kind of might be a red flag? So do they require tube feeding? Do they know the risks of, how are they going to train the worker? Do they have a nurse involved to do delegation to a worker? And then we're going to contact that person every month for the first 3 months to say, how's everything going? How's your worker doing? Do you need any more information about anything? Are there other resources you might need? So we've made that commitment to follow them every month for the first 3 months. So if somebody loses a worker, just like in Medicaid or OPI, they go onto the registry and they need to interview and hire another worker.
Jenny, often we hear from consumers, and we may experience it ourselves as OPI workers, that the registry may not have good phone numbers, or it may not have good contact information, or it's just so overwhelming that the consumer doesn't know how to start. How does your program assist people through those things?
Well, we walk them through that. So if they don't have a computer, for instance, or they're having trouble using it, we will walk them through the pre-screening and the self-assessment and all of that. Tell me again what your question was.
Well,
the record. Yes. Yeah. Okay. So what's nice about this, particularly since it's a new program, the home care workers have to sign an enrollment agreement, and on there they have to put their address and their phone number and their email address. So it's a way for us to check that against the information we have already in the registry.
So perhaps if we could say this be an accurate statement, I guess, is that this listing of home care worker people is more reliable than the home care commissions that are available for OPI and Medicaid?
The hope is yes, because we're going to have recent information that they've provided with us. So they don't always contact the local office and say, I moved, or I've changed my address or phone number. So we can compare that to what we already have, and if it's different, then we can contact the local offices and ask them to change it.
Are the health workers who work with these folks, are they able to assist with interpretation?
Oh, what a great question. No. I mean, they could, but it would not be through the program. It could be something that the consumer pays for privately.
I think we have crossed over all the questions. I see one more about, especially for non-English speaking clients or people that don't have access to a computer, this could be a challenging program. Is that true?
I think that's true of any program. Right. So we'll have our all our forms and everything. We'll translate them as soon as we know what the demand is for that. That's why we can walk people through it over the phone and use a interpreter over the phone.
So another question that's come in, other than Social Security and workers' comp, what is the cost for the fiscal? What is the cost for the fiscal intermediary and administration per hour?
So it's a rate. So there's some complicated behind-the-scenes formula. So from that rate, the fiscal intermediary gets paid $95 an hour. So if you were to break down the 2212, it doesn't translate exactly that 95 goes here and 14 goes there because it's based on a rate formula. So depending on how many people enroll in the program.
Okay, folks, it's looking like we've come to the end of our, oh, here's one. For your Vietnamese and Korean, Asian Health Services could help make printed copies of these services. So if there is someone in that situation, there is some resources, and I'll go ahead and have that for you so you can have that. Well, thank you, Jenny, for your time today.
Sure.
Folks,
my email address is everywhere, so if you do have questions after this, let me know, or my phone number. I'll be happy to talk to you on the phone. I miss actually talking to everybody on the phone. I don't know, some of you may know me. I did the Medicaid in-home policy.
For years, yeah. So, again, this is Sandy Abrams, and this is our quarterly OPI training, and we were happy to have our ADRC and options counselor coworkers with us today. Our next program will be in June, as I recall, and you'll be getting information more about that. I want to let you know that about an hour from now, you're going to be getting an email asking you to participate in a survey so that we can see how to improve this and what kinds of topics that you would like to have. I will also be sending forward to everyone who did participate today that information memorandum that Jenny referenced. Thank you so much for your time today, and enjoy the sunshine, at least that we're having here in the Willamette Valley. And with that, I'm just going to end our conference call. And by the way, I should have said this earlier, we have recorded this session, and it will be going on to the OPI training website so that you can reference this information. Thank you.